Alright, in this video we will be discussing about posterior transcortical aphasia. We have already discussed Justman syndrome, we have already discussed conduction aphasia and anterior transcortical aphasia. Now it is the turn for posterior transcortical aphasia. As the name suggests, transcortical means some part of the cortex is involved, and trans means more than one cortices are involved. We know that the cerebral cortex is divided into different areas. So more than one cortical area is involved in posterior transcortical aphasia, right? So there are, because it is aphasia, it must involve some part of the language network, right? Or it impairs the connection between the language and prefrontal network, right? So it somehow affects the language processing and language and speech output. So uh, I think we must understand that what is the anatomical basis of posterior transcortical aphasia. As the name suggests, posterior, we must draw a diagram of cerebral hemisphere of the cerebrum. This is the Wernicke's area. This is the auditory area. This is the central sulcus. This is the precentral sulcus. This is the prefrontal cortex, and this is the Broca's area. B for Broca's, W for Wernicke's, A for octave. And Broca's, is connected to Wernicke's through phonological loop. Because this is transcortical aphasia, there must be, there must be involved, because it's posterior transcortical aphasia. So there must be involvement of some posterior part of the language network. What is the posterior part? Posterior part is basically the posterior temporal or the posterior parietal lobe. This part is involved. This is the part of the cerebral hemisphere which is basically watershed zone. Watershed zone between the territories of the middle cerebral artery and posterior cerebral artery. This watershed zone is especially prone to ischemia whenever there is uh, severe, or there is obstruction to the flow of blood in this part of brain. There is more chances of ischemia, and when ischemia occurs in here, it involves the posterior language network, and it is known as posterior transcortical aphasia. Now we must understand that what are the features of posterior transcortical aphasia. As we have already understood that whenever we have to evaluate an aphasia, we must evaluate four things: C, R, N, and F. C is for comprehension, R is for repetition, N is for naming, and F is for fluency. Now Wernicke's area, here Wernicke's area is involved, and Wernicke's area is responsible for comprehension. That is why comprehension is impaired. Repetition is preserved because the phonological loop or the conduction pathway is intact, right? Comprehension is impaired, repetition is intact. Naming is impaired because some part of memory may be there in this part of cortex, so naming is also impaired. Fluency is preserved. Fluency is dependent on Broca's area, so fluency is preserved. So these are the four features of posterior transcortical aphasia. That is all about this posterior transcortical aphasia.